Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am Dr. Mubasshra and today I am here to discuss about thyroid examination. Before we start, I welcome you all to my channel. Thyroid examination is a very important short case in clinical medicine exam, and there is a proper scheme of thyroid examination. If you follow the steps, you can reach to the etiology of the thyroid disease at the end of your examination. Most of the time, the commands are examine the thyroid gland of this patient and do the relevant examination, or perform the general physical examination of this patient. The scheme of thyroid examination include number 1, greeting, number 2, introduction, number 3, consent. And how you will do these 3 steps. For example, you will say, hello, good morning, I am Dr. Mubasshra and I have been asked to examine your thyroid gland. Do you have pain anywhere? In case you feel any pain, please let me know. Then number 4 point is exposure. For example, if it is a female patient, at least her neck should be exposed, even if the command is general physical examination, because it may happen that you started examining from the hands and all that stuff and you didn't find any clue in the peripheries or even in the eyes. And then when you come to the neck examination, since the patient is female, she may have covered herself with a scarf or dupatta, and now here you will see the thyroid swelling, and now you have already spent half of your time in the short case, and now you can't go back to the hands for important relevant things that you should look for in the peripheries, because examiners will not like it. So proper exposure is very important. Then number 5 point is position. For thyroid, ideal position is sitting position. Then comes the general look of the patient. For example, in case of hyperthyroidism, patient will have anxious, restless and staring look. And in case of hypothyroidism, patient will have puffy face, depressed looks, coarse facial features, baggy eyelids and even xanthal asthmas. The voice is very important in case of hypothyroidism. There will be hoarse voice because of mixed sedimentary swelling of the vocal cords. And you can check the voice when you were taking consent from the patient or asking for any kind of pain anywhere in the body. After this, your next step will be according to the command. For example, if the command is examine the thyroid gland, you will start from the thyroid gland, and if the command is do the general physical examination of the patient, then you will start from the hand examination. So, your next step will vary according to the command given to you by the examiner. Moving towards the neck for inspection, you will start from the foot end of the bed and you will inspect for thyroid swelling or any other swelling apart from the thyroid. Head should be hyperextended a bit so that you can do a good inspection. And after that, you will look for the scar marks or FNAC marks quite carefully. After that, offer a glass of water to the patient and ask him to take a sip, hold it in his mouth, and when you ask him to swallow, then swallow and take it inside. In this manner, you will be able to see that whether the thyroid swelling is moving with deglutition or not. And then you will ask the patient to protrude his tongue out. If the swelling moves with sticking the tongue out, this may not be thyroid gland. Instead, it may be thyroglossal cyst. And here you can comment whether there is macroglossia, that is large tongue, or not in case of hypothyroidism. Then come towards the back of the patient, and for palpation, again you will ask for pain in the swelling, because it might be the possibility that the swelling is tender to touch, and in this way you will be able to comment that whether the underlying cause can be subacute or dequervant thyroiditis. The palpation of thyroid gland includes overlying skin, redness, warmth and tenderness, number of swellings whether single or multiple, then size of swelling. For example, let's say right side is more large as compared to the left side. Then comes the shape of swelling, that whether it is smooth, irregular, diffuse or multinodular enlargement. And then comes consistency, soft, firm or hard. Mobility, that whether it is mobile or fixed to the underlying skin. Swallowing test, again the same. And carotid artery palpation, you will palpate the carotid artery one by one, because in thyroid carcinoma there is invasion of carotid artery by the tumor and carotid artery may not be palpable. For palpation of thyroid, you will ask the patient to slightly flex the neck, because it will be easy for you to palpate. Then comes percussion. You will percuss the sternum for retrosternal extension and auscultate for any kind of thyroid bruit. Then examine for cervical lymphadenopathy, auscultate the bases of lungs, and check for sacral edema. Then comes eye examination. You will look for proptosis or exophthalmos, that is the lower part of white sclera will be visible. Then lid leg. You will ask the patient to follow your finger up, and when you will be able to bring your finger down, patient's lid will be hanging up. This is called as lid leg. Then lid retraction, that is the upper part of the white sclera will be visible. Then chemosis, that is redness, swelling or discharge, and extraocular muscle movement, that is the H movement, and ask for any kind of diplopia on extreme gaze, and look for ophthalmoplegia and even nystagmus as well because of cerebellar degeneration in case of hypothyroidism. Then comes hand examination. This part of examination is very important because it can guide you to find the cause of thyroid disease, that whether it is hypothyroidism or hyperthyroidism. Look for puffy hands. For example, let's say it is hyperthyroidism. You will ask the patient to outstretch their hands and come at the level of the patient and look for fine tremors. Then examine the nails for digital clubbing, which is known as thyroid acropathy. It is a feature of hyperthyroidism. Also examine the nails for onycholysis, that is Plumer's nails, and in this condition there is distal separation of the nails from the nail bed. Likewise, look for brittle nails. In case of hypothyroidism, there will be puffy hands, thick coarse skin, cold peripheries, and you will examine for tunnel sign or Phelan test in case of hypothyroidism for any carpal tunnel syndrome. Then come pulse examination. In case of hyperthyroidism, there will be tachycardia, atrial fibrillation or bounding or collapsing pulse. And in case of hypothyroidism, there will be bradycardia. Likewise, for blood pressure in hyperthyroidism, there may be systolic hypertension. And in case of hypothyroidism, there may be diastolic hypertension. Then comes examination of proximal myopathy. It can be there in both cases. Then precordium examination for gallop rhythm, flow murmur, or even atrial fibrillation. Then comes lower limb examination. Reflexes are very important in thyroid examination. Like if it is a case of hyperthyroidism, the reflexes will be exaggerated. And in hypothyroidism, there will be delayed relaxation of the ankle reflex. Likewise, you will look for pretibial myxedema, which can be there in Graves' disease secondary to hyperthyroidism. And again, you will look for non-pitting pedal edema as a part of hypothyroidism. Thank you so much for watching. Stay blessed. Allah Hafiz.